Hello, everyone. My name is Tracy Orwig. I'm an assistant professor of practice at the University of Texas at Arlington School of Social Work. I am a licensed clinical social worker, and my background is in healthcare. I've worked in a variety of healthcare settings. I've also worked to develop interprofessional education activities, IPE activities here at UTA in collaboration with many different health professionals, especially with the College of Nursing and Health Innovation. Hello, everyone. Our activity was an interprofessional education activity, or IPE. This activity provided an opportunity for our social work students and our nursing students to learn about, from, and with one another. The goal was to improve patient care and outcomes. In health, it's important to have collaboration between social workers and nurses in order to address domestic violence or interpersonal violence. Nurses are often the first contact with patients and can then refer to the social worker. The social worker can then assess and provide resources to the individual in collaboration with the nurse. The objective of the activity related to interprofessional education was to have social work and nursing students collaborate to develop an intervention plan for discussion with the patient. The interprofessional education competencies that we focused on for this activity are values and ethics for interprofessional practice, specifically looking at respecting the unique cultures, values, roles, responsibilities, and expertise of other health professions and the impact these factors can have on health outcomes. Maintain competence in one's own profession appropriate to scope of practice. Under roles and responsibility, recognize one's limitations in skills, knowledge, and abilities. Explain the roles and responsibility of other providers and how the team works together to provide care, promote health, and prevent disease. Competency 3, interprofessional communication. Express one's knowledge and opinions to team members involved in patient care and population health improvement with confidence, clarity, and respect, working to ensure common understanding of information, treatment care decisions, and population health programs and policies. Listen actively and encourage ideas and opinions of other team members. Under Competence 4, with teams and teamwork, engage health and other professionals in shared patient-centered and population-focused problem solving, and share accountability with other professions, patients, and communities for outcomes relevant to prevention and healthcare. Some lessons learned from this activity are involvement of stakeholders, so which instructors should be involved from the beginning as we plan the event, as well as which classes to incorporate this event into. Technology, ensuring that there's a simple and effective way for our students to engage and collaborate in the asynchronous environment. There were many questions as well as frustrations from our students related to communicating with each other within the learning management system. We also started with a large number of students for our pilot program. In hindsight, we could have considered a smaller number of students or maybe just a few classes, and it would have been easier to work out some of the technology and timing issues that we encountered during this pilot program. Timing of the event as it relates to classes, our nursing and social work students were completing the end of their semester. Specifically, our nursing students were done with their classes before the end of the activity. With student participation, our nursing and social work students were partnered up. Therefore, it would be important to have a backup plan if one student chooses not to participate. So we were considering having one already completed that you can provide to students in order to allow them to complete the activity individually. Our next steps for this activity is doing more training with the team and working on better utilizing our learning management system in order to simplify the engagement for the students. Identify the stakeholders, faculty, as well as classes earlier in the fall semester in order to implement the activity in the spring. Expand the scenarios in the simulation, particularly around diversity based on gender, IPV dynamics, or the presence of a child or an elderly family member. Currently, our next scenario that we are working on includes a safety planning for a survivor with a child. Additional steps are increasing cultural competence and interprofessional collaboration skills. We would like to focus on a standardized communication tool and the assessment of impact of the simulation on interprofessional communication skills. Thank you so much for attending our interprofessional education activity discussion related to safety planning And we just wanted to say a big thank you to everybody on the team that worked together to pilot this program and continue to implement it in order to enhance the education of our nursing and our social work students. Here are all the wonderful individuals that collaborated together in order to make this activity happen. And it was a big effort between the College of Nursing and Health Innovation and the School of Social Work. And we look forward to implementing this activity again in the spring for our students. Thank you.